guys, welcome back to my channel, The Jamie Nicole. I know I look crazy right now, but sometimes the show just must go on. I am currently getting ready for practice, but I decided that it was time for me to give you guys that OB clinical story time. So I'm gonna get that to y'all while I'm getting ready right now. So basically what happened, well, I'm gonna start by saying I love my OB rotation. It was definitely my favorite clinical rotation yet. I absolutely loved working with the babies. I enjoy working with the new moms, but I think that I have more of a calling for babies. Anytime that we did anything, whether it was a birth or C-section, whatever it was, I enjoyed the times when I got to go with the nursery nurses and take care of the baby and do the assessments on the baby and all the newborn like tests and shots, all that stuff. I just loved working with the newborns. So that definitely is making me lean towards either going into a postpartum or the NICU. So yeah, I just wanted to start off by saying that I absolutely loved my rotation. It was amazing, and yeah, definitely my favorite rotation since I've started. Oh, I just kicked the camera. Definitely my favorite rotation that I've had since I started nursing school. The story I'm gonna tell y'all is about my last day of OB clinical. So just for a little bit of background, we had clinical for 8 weeks. Well, it's technically 7 because you don't usually go to 8th week. It's just like a makeup week. But my whole class went the makeup week because we had a snow day like week 3 or 4 or something. So we ended up having to make up during week 8. So mind you, as many as you know, I do track, and my indoor conference was during our week 7 of our clinical. So I missed both clinical and skills lab for OB during week 7 since we were out of town for the track meet. So of course I got assigned all this different makeup work and all that, which is cool, but nothing is the same as getting to actually be at clinical and be with the patients in real life. All that to say, that day that I missed, my classmates was like, everything was popping. Jamie, you missed everything. Like, we saw hella C-sections, all these people was having babies. Like, it was lit. And of course, it was the day that I was not there. So coming into week 8, my instructor was like, okay, I want to make sure you get to see as much as you can since you had to miss a week and all that blah, blah, blah. So, you know, we try to make sure I saw as much as possible. So I got assigned to a patient who had a C-section at, I want to say we had to get there at 5:45. So I think the patient's C-section was scheduled for either 6:30 or 7 o'clock, somewhere around that time. And this was, I was actually assigned to this nurse who had this patient. So time came for the C-section. It was great. It was the first C-section I ever seen, and my teacher had knew to assign me to a C-section because she knew that that was one of my goals to get out of OB clinical, and I still had not got to see one, and it was our last day. So of course she was gonna put me on a C-section, period, because she was looking out for me. So we went to that C-section. Mind you, like I said, since I missed that week before, my classmates, everybody had got to see at least 1, if not 2 C-sections already. So we went there. In that first C-section, I want to say it was me and 2 more students in there. So it was a total of, I think, 3 students. And then I think there was a CRNA student in there too. So technically 4, but when it comes to like traditional nursing students, it was 3 of us. That's important. So hold on to that for later in the story. So went there. It went good. The patient had like an abnormal condition where her placenta, I don't want to say it on here because I don't know if that's like sharing too much, but essentially like it was a good C-section to see because there was a complication that we had learned about in class. So fantastic experience. My nurse and the other like assisting people in the procedure helped like walk us through everything that was going on. It was definitely a great experience. So then after that, we found out that there was another C-section coming around 9 o'clock. So then my nurse was just like, hey, there's another C-section coming. Like, you're welcome to go to that one too if you want to, because I know that, you know, you haven't got to see C-sections for real and you missed last week. Cool. I'm like, oh, for real? Bad. So I'm ready. I'm waiting around. So I went and I talked to the nurse whose C-section it was. So I went and talked to her. I was like, hey, my nurse told me to come, and my nurse said that it was okay if I came to the C-section with you. I just wanted to make sure, double check with you that it was okay. And she seemed a little apprehensive about it, but she ended up saying, yeah, you can come, that's fine. But mind you, she was a little apprehensive. So I felt a little uncomfortable, but I'm like, shoot. She said, yeah, so I'm gonna go. Then I saw the doctor there who was gonna perform the C-section. And I was like, just making sure, like, is it okay if I come and observe the C-section? I haven't got to see much in this rotation. And then she was like, I only want 2 students in there. So yeah, you can come, but nobody else. Okay. It was a little bit of attitude there, but you know, she said yeah. So I'm like, okay, cool, whatever. So then, for some reason, the nurse who I was gonna be following, or who I had just asked, she was like, well, maybe you should go ask the nursery nurse if it's okay that you're in there. Okay, that doesn't really make sense, but you know, you are clinical. I'm following instructions. You know, I'm not gonna be disrespectful. So I go into the nursery, I asked the nurse, and she's just like, yeah, that's fine. Like, she was looking like, why are you asking me? Exactly, we're on the same page. But, you know, I asked her, she was like, yeah. So I done got okays from everybody, right? So then I come back out of the nursery, and the nurse and my classmate who was with her, they had disappeared. So I'm just like, they're probably in the patient room, but you know, I wanted to ask, and the doctor was still sitting there. So I was like, excuse me, do you know where they went? Are they in the patient room? And then she said some smart remark to me, which I don't even remember what it was, but it really rubbed me the wrong way. I'm just like, you could have just answered the question, said yes or no. But I'm still, you know, not letting it get to me, because I'm getting to go see a C-section. So cool, whatever. Anybody can have attitude. I don't care. I still get to see the experience. So then fast forward, I catch up with them. We get into the operating room. You know, we back tucked up. Me and my classmate, we back tucked up in the corner like that. Like, ain't making a noise. Only doing what people ask us to do. We deep in the corner, like this. So then things start to get started and whatnot. Stuff starts to get started. And I forgot that I was even getting ready for practice. Things start to get started and whatnot. Like I said, out of the way, not making no noises. And the one nurse kind of just kept looking back at me. I'm just like, why she keep looking at me? Mind you, I'm the only one of us in there. So I was, you know how that be. I'm already slightly uncomfortable. So I'm like, okay, why she keep looking at me? And how I told y'all, she was acting kind of apprehensive about me coming or not. So I started to feel uncomfortable. And then, like, they started yelling at me because they were saying, oh, you need to get away from the sterile field, da 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 da. Mind you, I'm not touching nothing. I'm like, we're literally like this, like hands was in front of us, like not making no noise, not doing anything. So I'm just like, okay, why are people just finding reasons to catch attitudes to me? I don't like it. So I'm like, okay, I'm gonna just keep standing here, whatever. Then the doctor is finna start or whatever. Mind you, when she came in there, she didn't have no attitude with us at all. Like, she was being all nice to us. Like, she wasn't just being rude back at the nurse's station. So, I guess when she was finna start, and like at the beginning of a C-section, they have to start testing how the numbing stuff is working. So they just start kind of pinching the mom in her stomach uterus area to see if she can feel how much pressure she can feel, and if she can feel like when she's gonna be getting cut and whatnot. So when they start doing that, like I said, the nurse kept looking back at me. I'm just like, okay, like she's making me hella uncomfortable at this point. Me and my classmate standing back there, then she turns around and she was just like, she was talking to me. She goes, and you've seen a C-section before, right? I was just like, yeah, the only one I've ever seen was this morning. So yeah, I guess, yeah. And she goes, well, you need to leave. And then she like reaches out and grabs my arm. Like she's like, well, you need to leave. Come with me. Mind you, the nursery nurse had just came in with 2 more of my classmates. So it's a total of 1, 2, 3, 4 of us traditional nursing students in there, and an anesthesiology student. I'm just like, I was just kind of speechless, because I'm just like, first off, even if she only wanted 2 students, me and my other classmate was the only 2 students in her. And then everybody else walks in, and then you directly call me out talking about some, you need to leave. Good. It was giving very much discrimination, but you know, it's whatever. I was a little hurt, you know, because mostly I was embarrassed, because I just felt like, why would she call me out in front of everybody in that entire operating room like that? And I literally didn't do anything wrong. So I was mostly embarrassed, but at first I was irritated, because I'm just like, there's no other C-sections for today. So who's to say if I'll be here to see another one? Because the patient that I had after her C-section was over, she's gonna go up to postpartum. And I don't know if anybody else was having a vaginal birth that day. So I was a little upset. And like I said, I was embarrassed. So then my other classmate, she was one of us. She was like, no, it's okay. Jamie can stay. I'll leave. And then my other classmate was like, no, I can leave. So then all 3 of us ended up just leaving, which I love them for that, because it kind of took away some of the embarrassment away from me. And like everybody in there could tell that doctor was just being rude, and that nurse was rude to me for approaching me like that after confirming multiple times that I could come into the procedure. So yeah, luckily they left with me, which I don't want to seem like I don't want to seem like a charity case, like people gotta come save me and whatnot, but that was a nice gesture of them, because if they really wanted to, they could have stayed and experienced that for themselves, since they didn't really get kicked out like as blatantly as I did. So I really appreciate them for that. But yeah, that mess was crazy. And honestly, like, I feel like it's really hard to even explain the feelings that I felt. But yeah, like I said, it was mostly just embarrassment. And like, I just felt like I got slapped in the face, because I was really excited and I didn't do anything wrong, but I was still suffering consequences. But you know, after I left out of there, one of the nurses was just like, you know, like, sometimes you'll deal with people who don't have that much power, and since they feel powerless, they'll do anything so that they can be superior to others. And that stuck with me, because that is so true. Like, people so many times when they feel small, they'll work so hard as hell, to make sure that others are smaller than them and below them. And that's what I learned today. And that's why after that, I ended up going into a 3rd C-section. So laugh in her face, period. Which was also fantastic. I got to put the Foley in for that mom, so that was really great. And she was a mom of color, and a doctor of color performed the surgery, period. But yeah, so that's the story time. Well, that's the probably most interesting story time from my OB clinical rotation. And that's all I have for you guys today. I hope you enjoyed this little story time. Please leave below in the comments if you want more story times on my other clinical rotations. As always, be sure to like, share, and subscribe to my channel so that you can keep up with all things The Jamie Nicole. I will see you guys next time. Bye.